For some people taking injectable GLP medications, tirzepatide, which is Mounjaro or Zepbound, or semaglutide, which is Wegovy, for weight management, switching to a GLP medication in a pill form might look attractive. A pill doesn't need to be refrigerated, there are no bulky pens to carry around, traveling with them is easier, and they might be cheaper. Note to Canadians, GLP-1s in a pill are not yet available, but expected to come to Canada soon. For a background on GLP-1 pills, check out my prior blog, which I've linked in today's blog. So make sure you check that out. So, hot off the presses in Nature Medicine, the Attain Maintain study aimed to answer this question: can people maintain weight and health benefits after switching from injectable GLP-1 to the oral GLP-1 orforglipron? And will a switch be well tolerated from a side effect perspective? Okay, so the first thing I'll say here is that the study had a complicated protocol and an extremely complicated set of analyses conducted. This isn't the kind of study where you can just read the main findings to understand what it really teaches us. So let's walk through it together, and I'll highlight the findings that can really guide clinicians and patients in their decision making. The Attain Maintain study looked at people who had stuck with treatment in the Surmount 5 study, which I've also blogged. Check that out, it's linked here, with either tirzepatide at the maximum tolerated dose of 10 or 15 milligrams weekly, or semaglutide at the max tolerated dose of 1.7 or 2.4 milligrams weekly. And if they were weight stable at the end of that study, they were then randomized in a 3:2 ratio to receive either orforglipron, started at 12 milligrams daily and titrated up to 36 milligrams, or the maximum tolerated dose of 24 or 36 milligrams, or placebo for another year. People had to have lost at least 5% weight during the Surmount 5 study and had to have a BMI of at least 22 at the end of Surmount 5, meaning at the start of the Attain Maintain study. So first, let's look at the two groups at the start of the Attain Maintain study, in other words, at the end of the Surmount 5 study. People who finished Surmount 5 on tirzepatide had a lower average weight, 90.1 kilos, and a lower average BMI of 31.2 at the start of Attain Maintain than those who had been on semaglutide in the Surmount 5 study. They had a weight of 94.4 kilos and a BMI of 33.2 going into the Attain Maintain study. Metabolic health was similar in the two groups, with the exception that 15% of the semaglutide group had prediabetes range A1C at the start of Attain Maintain versus 5.9% of the tirzepatide group. Okay, before we get into the results of Attain Maintain, here's a key point to note. Starting at week 24, if 50% of weight loss during Surmount 5 was regained during Attain Maintain, orforglipron rescue therapy was started, meaning that the placebo group would get orforglipron, very patient-centric, which is great, and people who were randomized to orforglipron but regaining weight despite this would receive an additional placebo orforglipron to maintain blinding so that no one knew what they were actually taking. The results. So the primary endpoint of the study showed that for people who initially lost 21.5% of their weight with tirzepatide, when they switched to orforglipron, they maintained 74.7% of their weight that they lost with tirzepatide. The people switched to placebo maintained 49.2% of their weight. However, 65% of people in the placebo group received orforglipron rescue therapy because they had regained at least 50% of their weight lost originally. So the weight maintenance in the placebo group reflects that many people in that group switched from placebo to orforglipron. Also, in the group assigned to switch directly from tirzepatide to orforglipron from the start, 16.8% of people regained at least 50% weight. For people who were adherent to treatment with the direct switch to orforglipron, their weight loss from baseline of the beginning of tirzepatide to the end of the orforglipron treatment was 16.8%. So, key point, they were up about 5 kilos with the switch from tirzepatide to orforglipron. Much of the metabolic health improvements like blood sugar, cholesterol, and so forth seen with tirzepatide were well maintained with orforglipron therapy, except for blood pressure, which was lowest at the end of tirzepatide treatment. Okay, now let's look at the semaglutide cohort. For people who initially lost 16.5% of their weight with semaglutide, when they switched to orforglipron, they maintained 79.3% of their weight. The people switched to placebo maintained 37.6% of their weight. However, 64.6% of people in the placebo group received orforglipron rescue therapy. In the group assigned the switch directly from semaglutide to orforglipron from the start, 21.9% regained at least 50% weight. In the group adherent to treatment with the direct switch to orforglipron, weight loss from the baseline of starting semaglutide to the end of the orforglipron treatment was 15%. So, key point, they were up about 1 kilo with the switch from semaglutide to orforglipron. Metabolic health improvements, blood sugar, cholesterol, and so forth seen were well maintained with orforglipron therapy. Another interesting data point is this. For people initially on tirzepatide and switched to orforglipron, 43.7% of people were able to maintain at least 80% of the weight loss they had achieved with tirzepatide. For people initially on semaglutide and switched to orforglipron, 55% were able to maintain at least 80% of the weight loss they had achieved with semaglutide. There were no new safety concerns with orforglipron in the study. The switch from either tirzepatide or semaglutide to a medium dose of orforglipron, 12 milligrams daily, and titrated up from there was well tolerated. So, the bottom line, people switched from either tirzepatide, which is Zepbound or Mounjaro, or semaglutide, which is Wegovy, to the oral GLP1 orforglipron in a pill, were able to maintain the majority of their weight loss and metabolic health benefits with some regression of both on average and a wide range of response from one person to the next, as is typical of weight management medication. For people wanting the most possible weight and metabolic health benefit, this study suggests it's best to stick with the injectable. For those who feel that a pill would be more convenient or maybe cheaper, some will do quite well with a switch to orforglipron. It's also important to remember, per our Obesity Canada clinical practice guidelines and other guidelines around the world, we should be guiding medication choice according to the health benefits that are proven for each medication. As a disclaimer, I've been involved in clinical trials of orforglipron, semaglutide, and tirzepatide. I receive honoraria as a continuing medical education and speaker from the makers of orforglipron and tirzepatide, which is Eli Lilly, and semaglutide, which is Novo Nordisk.